Hello everyone, I am Dr. Omprakash Jamadar, Consultant Pediatrics and Neonatology at Apollo Hospital in Mumbai. Today we are going to discuss about infant protection. So let's try to understand what is infant. Infant is a child who is less than 1 year of age. So protecting the infant doesn't start after the birth. It starts when the baby is in mother's womb. So when conception has happened, from that time the initial 1 year of time frame is very essential, because the maximum brain growth, the maximum development of the baby happens during this time frame. So mother's nutrition is very essential to have a good size of the baby at the time of birth. And that's the reason we make sure by regular antenatal ultrasound scans, regular antenatal visit, that mother's nutrition is taken care of and baby's growth is also well maintained. During this time, we can also recognize certain problems that baby may be having, like growth retardation or some congenital anomalies are there. They can be picked up and then taken care of. After the birth of the baby, we need to make sure that baby is initiated on mother's milk within 1 hour of life. We call it as like a golden hour of life. And that helps a lot to improve the digestive system of the baby. Babies get healthy bacteria in their intestines, in their gut, that will help them a lot for the development of not just physical development but also for the brain development. So after that, we make sure that for initial 6 months baby is on exclusively breastfeed until and unless medically indicated. So this 6-month time frame, we should avoid giving outside water, outside milk as much as possible as suggested by the doctors, and then continue on breastfeeding. After 6 months, we do start complementary feeding. I avoided the word weaning food because it is complementary to the mother's milk. So mother's milk will be continued till 2 years in fact, and along with that we start outside food from 6 months when the digestive system of the baby is ready to digest the food from outside. So I will divide the infancy time frame in terms of the importance in 3 components. One is the development of the brain. Second, development of the immunity, that is the immune system of the body, the fighting capacity of the body. And then third, having a good nutritious physical growth of the baby. So brain development, as I said already, it happens, 90% of the brain development happens during the initial 2 years of time. And that's the reason we make sure that baby gets all the essential nutrients, particularly DHA is there, which is important for the development of the brain, which is important for the development of a good IQ. And mother's milk has got essential micronutrients. They help a lot for development of the nervous system, the brain system that baby are having. Second, for the development of the brain, we do need social interaction with the environment. And that helps a lot for future generations to have a healthy social and physical growth in their life. After brain development, we'll talk about the development of a good immunity. Mother's milk plays a vital role. Along with that, we need to make sure that the child is getting all the necessary vaccines so that they are protected from the common diseases like loose motions or respiratory infections, cough, cold that we see in different seasons. So taking adequate vaccine is one important part. Second, exposure to the environment also helps them to prevent certain common conditions like even allergies are also taken care of. We must be aware that many kids are allowed to play in the mud, that helps them to develop a good immunity system. Next is a physical development for which nutrition is very vital. For the purpose of having good nutrition, we start complementary feeding from 6 months of age, and then we increase it gradually as per the tolerance of the baby. I always suggest to start one thing at a time, continue same thing for 2-3 days, and then you increase the quantity and frequency as per the adaptation of the baby. Don't use salt and sugar when you are starting the outside food. Homemade food is always better. Start with one thing at a time, like if you are starting with rice, mash the rice with some water, make a porridge or puree of that, and then with a spoon you can feed the baby. Don't make it very thick or don't make it very thin watery, because we want to have adequate nutrition. And once the baby is adjusted to that, You can add dal into it, something like khichdi that we can make in our homes many times. So in this way, we can increase the different varieties of food, add vegetables into it, add fruits into it, increase the consistency as the baby development happens further. Somewhere around 8 to 9 months, we can start finger food so that there is a good hand-mouth coordination that can be utilized for the purpose of giving a good nutritious homemade things for the child. And by 12 months, we expect the child to be sitting with the parents and having the food of the parents. And that indirectly tells us that our food also need to be equally healthy, less salt and sugar into it, less processed food into it. So in this way, we want the child to be growing well physically, not obese as well as not malnourished. And regular check of the weight, along with the head circumference, and looking at the height of the length of the child also make sure that they are developing well physically. And developmental assessment also tells us how is the brain growth of the child happening. So in this way, we should make sure that all infants are taken care of physically, mentally, and socially. There was a good study where they looked at the adverse childhood experiences. The babies or children who have had a bad adverse experiences during their childhood, they had a high risk of suicidal tendencies, high risk of personality disorders, and depression. So good experiences during the childhood, during infancy are very vital to have a healthy generations that we are going to see in future. Thank you very much.